Good morning everyone, we are from SGD B7. We would like to present our student project with title Revascularization Management in Acute Ischemic Stroke. Here are our members.
I'm Maria Pramesisa Benavarana, and with student number 102 will explain about the background of this paper. Stroke is the second major leading cause of death in Indonesia and most of the countries worldwide. According to data published by WHO in 2018, mortality rate of stroke in Indonesia is 14.93% of total death. There are two types of stroke. First is ischemic and second is hemorrhagic. Acute ischemic stroke is defined as stroke caused by sudden loss of blood circulation to the brain area, which results in loss of neurological function caused by blockage in arteries, which supplies oxygen-rich blood to the brain caused by hyperperfusion, embolism, and thrombosis. Before the 90s, management of AIS was limited and mainly focused on symptomatic management, secondary prevention, and rehabilitation. In 1995, the introduction of intravenous tissue plasma organ activator or IVTPA usage as AIS in treatment lasts for 2 decades up to the new emerging treatment of intravenous thrombolysis or IVT and endovascular therapy or EVT. Nowadays, IVTPA administration alongside with revascularization is the two main management of AIS since it has been shown to be effective in reducing the risks of long-term disability caused by AIS. Whilst most of the stroke clinical signs are insignificant, early detection may promote better treatment. Signs and symptoms of AIS may slowly be progressive and develop after several hours. That's why promoting the 8D stroke care is necessary. The 8D stroke care itself has pointed out certain points that need to be marked up such as detection, dispatch, delivery, door, data decision, drug or device, and disposition. In short, it is important to recognize the symptoms reporting to the emergency medical services as soon as possible. Also, immediate clinical examination and neuroimaging is needed in order to decide the management and treatment. These are the formulation of problems and purposes of this paper as shown in the slide, and this is the benefit of this paper as shown in the slide.
My name is Atsa Sultan Pratama with student number 104. Stroke can be divided into ischemic stroke, hemorrhagic stroke, and subarachnoid hemorrhage. Then, in the terms of its duration, stroke may be divided into acute, subacute, and chronic stroke. Generally, an acute stroke is divided into two categories, which are acute ischemic stroke and acute hemorrhagic stroke. The acute ischemic stroke can be defined as cerebrovascular accident that occurs due to blood vessel blockage, which hinders the brain to obtain enough blood supply. According to TOES, the trial of ORG 1172 in acute stroke treatment classification, ischemic stroke can be further classified into four main types, which are large vessel atherosclerosis, small vessel diseases, cryptogenic stroke, and cardioembolic stroke.
Thank you for the time. My name is Joshua Limanto with last 3-digit number 035. Ischemic stroke is the most prevalent type of stroke in the world, reaching 68% out of all stroke cases. In Indonesia itself, stroke morbidity reaches 21%, and most of them are ischemic type of stroke. Several researchers concluded that both gender and age has an indirect or a presupposed correlation to stroke. A research in India has stated that the epidemiology between men and women that get stroke is approximately 1 to 3. And other research stated that people with the age of 65 to 84 has a higher chance of getting stroke than people with a younger age. But neither of the studies has thoroughly examined a direct correlation between those variables. Therefore, more research is needed. In terms of its fatality, ischemic stroke also has a significant amount of mortality rate, which reaches 15%. This number shows a significant amount of fatality caused by ischemic stroke. It reaches almost 4 times the rate of meningitis and is comparable to acute kidney injury. Hence, it can be concluded that ischemic stroke is a significant problem that we need to address because it has both high morbidity and high mortality rate.
Thank you for the opportunity. My name is Eduardo Kinjiro with my last digits of student number is 119. Now I'm going to explain about the etiology and risk factors of acute ischemic stroke. The two main causes of ischemic stroke are due to either thrombotic events or embolic events. These two events cause a decrease in blood flow to the brain. In a thrombotic event, the blood flow is decreased due to problems of the blood vessel itself, such as secondary to atherosclerosis disease, arterial dissection, fibromuscular dysplasia, etc. Meanwhile, in an embolic event, debris from other parts of the body obstructs an affected vessel. The risk factors of ischemic stroke play a big part in determining the incidence and pathophysiology of ischemic stroke. These risk factors are age, sex, and sex-specific risk factors. Age and sex differences are actually related because women tend to develop ischemic stroke older than men. Unlike age that is unmodifiable, sex-specific risk factors are modifiable. Women have unique ischemic stroke risk factors, including hormone replacement therapy, or HRT, pregnancy, menopause, and oral contraceptive pill use, or OCP use. Even though the incidence of stroke is significantly lower in women of reproductive age, but the use of OCP increases the risk. Stroke incidence in pregnant women also increases and is especially high risk during the final trimester and early postpartum period. Other sex-specific risk factors include atrial fibrillation, or AF, metabolic syndrome, diabetes, hypertension, and coronary artery disease, or CAD. All of these are shared. That's it from me. Next one is going to be explained by my colleague. Thank you.
My name is Sarah with 3-digit number 073. Now I'm going to talk about the pathophysiology for acute ischemic stroke. So the pathophysiology can be caused by the occlusion of an artery to a specific region of the brain. The first cause, it can be caused by global hypoperfusion, in which there is cardiac arrest, which causes zero cardiac output and causes no blood flow to the cerebrum for a long time, which leads to ischemia. Acute respiratory failure can also cause significantly low oxygen to the brain and leads to ischemia. Too much hypertension medicine or shock like septic shock, urogenic shock, cardiogenic shock, it can be the pathophysiology too. So one is the thrombus, in which there is a blood clot forms inside an artery that supplies blood to the brain, which interrupts blood flow and causes stroke. It can affect the large vessel and the small vessel. Then next is emboli. Emboli is a blood clot or plaque fragments form usually in the heart or large arteries leading to the brain. Then it moves to the arteries to the brain. In the brain, the clot blocks the blood vessel and it leads to acute ischemic stroke.
Good afternoon, ladies and gentlemen. My name is Kizia Gavrila with last 3 digits of my student number 160. Today I'm going to present the signs and symptoms of acute ischemic stroke. Basically, the signs and symptoms are the same as stroke, which are numbness or weakness of the face, arm or leg, especially on one side of the body, confusion, trouble speaking, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination, severe headache with no known cause. All of these symptoms happen suddenly or with unexpected onset. The effects of an acute ischemic stroke may cause additional symptoms in women, including face, arm, or leg pain, hiccups or nausea, chest pain or palpitations, shortness of breath. Not all symptoms occur with every stroke, and sometimes they go away and return. Albeit such manifestations can happen alone, they are bound to happen in combination. No recorded element recognizes ischemic differently from hemorrhagic stroke, in spite of the fact that queasiness, heaving, cerebral pain, and abrupt change in degree of awareness are more normal in hemorrhagic strokes. Thank you.
Hello, doctors and friends. My name is Anish Sharma with name 3 last digits 251, and here I'll be explaining about the treatment for acute ischemic stroke. For treatment of acute ischemic stroke, doctors are required to restore the blood flow to the patient's brain quickly in order to treat acute ischemic stroke. It is able to be done with emergency intravenous medication or emergency endovascular procedures. Using emergency intravenous medications, an intravenous injection of recombinant tissue plasminogen activator, also known as Activase, is the gold standard treatment. The injection is usually given through the vein in the arm within the first 3 hours. It can also be given up to 4.5 hours after the symptoms of stroke occurred. The drug dissolves the blood clot which caused the stroke in order to restore the blood flow. Hence, more people are able to fully recover from stroke by removing the cause of stroke quickly. However, with emergency endovascular procedures, there are two procedures required. First are medications which are delivered directly to the brain, and secondly, removing the clot with a stent retriever. For the procedure where medications which are directly delivered to the brain, doctor usually inserts a long thin catheter through an artery located in the groin and treat it to the brain of the patient in order to directly deliver TPA to where the stroke occurred. For the procedure where the clot is removed using a stent retriever, a device attached to a catheter is used by doctors in order to remove the clot from the blood vessels which is blocked in the brain. That is all from me. Thank you for listening.
My name is Etienne, and I want to explain about definition of revascularization and modes or type of revascularization in AIS. Revascularization by means is the restoration of perfusion to a body part or organ that has suffered ischemic. Revascularization treatment for AIS are generally restricted within 3 hours for intravenous tissue, plasminogen activator, and 6 until 8 hours in case of intraarterial thrombosis and mechanical thrombectomy. A mode or type of revascularization in AIS, such as glycoprotein 2B or 3A receptor antagonist, mechanical recanalization, mechanical clot disruption, percutaneous angioplasty, and the last one is aspiration thrombectomy. Thank you.
My name is Komanyani Putri, number 031. Indication of revascularization in acute ischemic stroke. Revascularization treatment in acute ischemic stroke that have been shown to reduce long-term disability in randomized trial are intravenous thrombolysis or IVT and endovascular therapy or EVT. The indication for performing IVT and or EVT are: the first one is to establish a diagnosis that the patient really has an ischemic stroke. The second one, if there is acute occlusion of the proximal intracranial artery and or fluctuating symptoms. And the indication for IVT only if a stroke occurs in the initial onset of less than 4, half, maximum 5 hours. And the indication for EVT are the treatment onset less than 8 hours, CT aspect more than equal to 6 and or MRI less than 100 ml in the middle cerebral artery stroke and the presence of acute intracranial artery occlusion.
My name is Cukur Desra Bantu Pemayun with student number 252. Some of the contraindication to IVT you can see in table 2.1 are the presence of acute or subacute intracranial hemorrhage on imaging examination, symptoms that lead to the presence of subarachnoid hemorrhage, history of subarachnoid hemorrhage with or without known bleeding source that has not been treated properly, presence of a sufficiently large aneurysm, presence of active intracranial malignant tumor, history of intracranial or intrasmal intervention within less than 14 days, except lumbar puncture, presence of moderate or severe traumatic brain injury within less than 6 weeks, test result known to ENR more than 1.7 or APTT more than 40 seconds. If this condition on table 2.2 are encountered, the patient should be evaluated to be considered for EVT. Patient with large vessel occlusion, stroke in the anterior circulation with contraindication to IVT should receive first-line treatment named EVT. Pregnancy is also relative contraindication to IVT, and EVT can be considered according to criteria used in adults.
Good morning, Dr. Good morning, my friends. I would like to tell you about the prognosis of the revascularization. My name is Nasora, student number 135. So the method for the revascularization, there's two methods: IVT or intravenous thrombolysis, and the second one endovascular thrombectomy. The first one, IVT, it may lower the mortality rate of ischemic stroke patient by significant amount, up to 37%, and also add patient lifespan 1 year longer, but not significantly increasing the long-term mortality rate. IVT also improve patient functional status and reduce of developing disability. So the patient can do the basic lab tasks. The second one is endovascular thrombectomy, which is a method
That is a use mechanical technique by inserting a catheter to remove blood clot. This is have a high success rate for almost 90%, but the long-time mortality is also low. Now we move to the complications. For IVT, 30% of patients develop orolingual edema, especially patients that are taking anesthesia and converting enzyme inhibitor for reducing blood pressure. As for the endovascular thrombectomy, as I said before, the long-term mortality is low, so the 9-day survival rate after pressure having 30% mortality. Another thing is complication is not likely to happen, but some people may develop stroke, intercerebral hemorrhage, emboli to neurovascular territories, vessel dissections, vasospasm of the access vessel, stent dislocations, and also stent occlusions. Thank you.
Good morning, doctor and friends. My name is Ayumanawati Santoso, number 007. I will present about the conclusion of our student project. Acute ischemic stroke is a cerebrovascular accident that occurs due to blockage of blood vessels which interfere the brain to get enough blood supply. In Indonesia, stroke morbidity reaches 21% of the population and most of the cases are ischemic stroke. Risk factors of acute ischemic stroke vary from age, sex, and sex-specific risk factors. The pathophysiology of acute ischemic stroke is from ischemic occlusion that causes thrombotic and embolic situation. For ischemic stroke, there are combination of discernible stroke signs and indications such as unexpected onset of hemiparesis, monoparesis, or sodium quadriparesis, hemisensory deficiency, and H. For the treatment, doctor can choose emergency IV medication or emergency endovascular procedure. Revascularization is restoration of perfusion to a body part or organ that has suffered ischemia. There are 5 types of revascularization and acute ischemic stroke, which are glycoprotein 2B or 3A receptor antagonist, mechanical recanalization, mechanical clot disruption, percutaneous angioplasty, and aspiration thrombectomy. Revascularization treatments in acute ischemic stroke are intravenous thrombolysis or IVT, and endovascular therapy or EVT. Some of the contraindications to IVT are the presence of acute or subacute intracranial hemorrhage on imaging examination. In the study, patients with IVT show great improvement in their functional status. For the complication, revascularization, both EVT or IVT, increase the long term of mortality rate. Thank you.
Thank you and have a nice day.